Technical topic, low emissions clinical care. Where do the GHGs come from? For clinical care, the emissions can come from a variety of sources. Many studies of GHGs from procedures and operating rooms show that the production of supplies, especially single-use supplies, is a major source of emissions. Depending on the type of clinical care, energy consumption and the sources of that energy can also produce substantial emissions. Still, other care pathways may generate a majority of emissions from patient commuting. For example, frequent trips for cancer care or dialysis. Most of these emissions are in a health system scope 3, though energy is usually scope 2. What kinds of initiatives can reduce GHGs? Anesthesia and inhalers. This particular grouping was pulled out because anesthesia and inhalers have some inherent greenhouse gas emissions. Some anesthetic gases, like desflurane, are themselves greenhouse gases, and for metered dose inhalers, the propellants that are used are greenhouse gases. Implementing interventions here will require the support of your anesthesia team and team members and may require some changes to your health system's formulary and procurement practices. Actionable strategies and resources. So here I'm going to read through a list of potential strategies, and if you go into Canvas, you can click on one of these to access tools, resources, and case studies that illustrate their successful implementation. So here's the list. Reduce fresh gas flows, FGF, and nitrous oxide use. Remove desflurane as a standard inhaled anesthetic in operating rooms. Shift to intravenous anesthesia or regional anesthesia where clinically appropriate. Recapture waste anesthesia gas. Shift from metered dose inhalers to low emission inhalers, such as dry powder inhalers or DPIs when clinically appropriate. Care pathways, pre-work and team members. The opportunities here are vast, given that every care pathway could be assessed and optimized. It may require clinical champions who can help shepherd changes through their departments and care areas. You could consider building support through clinical professional societies who sometimes have sustainability committees or teams. For example, iSustain for ophthalmology, and in radiology or physics, Radiologists for a Sustainable Future, the Radiological Society for North American, RSNA's Committee for Environmental Sustainability, and the Working Group on Environmental Sustainability and Medical Imaging Physics, for example. There are many other societies that have groups working on this. HealthcareLCA.com can also be used to look for GHG emissions specific to care pathways, procedures, and departments. As emissions from care pathways often start with supplies or energy, check out those sections in our Canvas site as well for other potential interventions. Actionable strategies and resources. Again, here's the list where I will tell you a little bit more about specific sustainability strategies, and you'll be able to access tools, resources, and case studies on Canvas. So here's a list. Follow Choosing Wisely or the Get It Right First Time and other guidelines for appropriate care at the right time. Transition away from fee-for-service to alternative payment models or value-based care reimbursement. Expand telehealth options where medically appropriate and there are no insurmountable barriers to using telehealth. Utilize lower resource services where appropriate, for example, using ultrasound instead of CT or MRI. Conducting smaller procedures in a procedure room rather than an operating room, etc. Assess opportunities to reduce steps in the care pathway, case by case depending on specialty. Examples include bilateral procedures for eye care or wide-awake procedures for hand surgeries. Assess material supply use to optimize, reduce, and reuse. Here, you should also see the sourcing and waste topics.